Thank you, Jim. Hi, everybody, and welcome to, as Jim has said, the third in our series of webinars, which we've developed for people with HIV during COVID. Why did we do these? We recognized really early on that some of the issues that were going to impact on us as people living with HIV needed to be addressed. And we recognized that many of our services and support centers where we would go to get advice and support are closed right now. Many of them have moved online. Some of us are still able to access them, but we thought it was really important to create this space where we can bring in key figures and experts, but also our peers to provide updated information, resources that we might need to get us through this time. There have been lots of concerns over the past couple of months. People have concerns because they've received texts or messages from their GPs or health services. There was lots of confusion about whether or not we should shield or not shield. So we want to make sure that people have the right information. And also we wanted to try to provide an opportunity for people to connect, because very often we might go to support services or go online and we're not able to do that. So we hoped by doing these webinars, we provided a platform to do that. We want to acknowledge, first of all, that this is that everybody is impacted really differently. We know that we can't address every single need, but we are attempting to answer as many questions as you can and to reassure people with up-to-date and relevant information. Again, this is a peer space, and as Jim has said, please use the chat function to share your experiences and post your questions or any advice that you may have, particularly today, because this is also about peer support. I also just want to acknowledge that today that our speakers are all cis men. We have in the past done our very best to try to make sure that our speakers are as diverse as possible. Today we haven't quite done that, but we do know that our speakers will be able to speak to all of our communities. And please, again, engage and involve and give your own experiences. So just before, and the final thing I want to say is that we acknowledge that lots of people can't actually join us today, either because of technical issues, they may not be in safe spaces, a variety of reasons. So please cascade the information and resources that you learned today to people that you might know who may not be able to be here today. So before I hand over to our speakers and introduce them, just in terms of the format of what we're going to do. So each speaker is going to have between 7 to 10 minutes to talk about their particular topic. And today's session is about accessing clinical and community services and also a COVID-19 update. The last time we did one was the day before the lockdown. So Michael Brady is going to give us a quick overview of if anything has changed, and that'll be at the end of the session. We put you on mute so that our speakers can talk. So please, if you have questions or comments, put them in the chat function and Dominic will pull those all together and we'll answer those at the end of them. We'll endeavour to answer as many questions as possible, but if we don't, we'll try to ensure that we can answer those in the resource list at the end, or our speakers will certainly cover them. So without further ado, I'd like to introduce our speakers, and I'm going to ask them all a question in a moment. So we have Michael Brady, who is a medical director at the Terrence Higgins Trust, Gary Bruff from Positively UK, and Jose Mejia from the Metro Centre, who is going to be talking about peer support in London. So before we go into you all individually, Michael, I'm going to ask you all a question. So Michael, first of all for you, just tell us, how has the COVID-19 lockdown and all of it situation impacted on you personally?
Well, I think personally, because I haven't actually been locked down that much because I've been at work, I'm an HIV sexual health doctor. So the way it's impacted on me is I was redeployed into the hospital to work on the COVID wards. And I don't normally work on the wards. I work in the HIV outpatient department. And I haven't been on the wards for about 16 years. So that was a challenge, getting my head around working on the wards and doing a whole different kind of medicine than I usually do. So that's been the newness and the impact, I guess, mostly for me.
Thanks. And over to you, Gary. How has it impacted on you personally?
So the first couple of weeks didn't make a lot of difference. I do quite a bit of my work from home anyway, and so it was an easy transition. But then 2 weeks in, there was a decision in relation to what the organizational finances were for Positive UK to look at who could be furloughed for the next couple of months. And so I've been on furlough for the last 6 weeks, and that has slowly driven me crazy, I must admit. I do very well with working from home. I do very well with structure. And so I've taken up a daily yoga class. I've started a creative writing course. I've been walking the dog more than actually I probably should be. But it's been challenging. I found being stuck at home really tough. It's without the focus of work to deal with. So yeah, it's been a challenge, but I'm okay. And I'm back to work on the 18th, thankfully. So yeah.
Thanks, Gary. Jose, I'm conscious that I really messed up pronouncing your surname, so I apologize. So Jose, what is your correct pronunciation?
That's fine. That was fine, Mark. Yeah, I mean, thank you for having me, and thank you everyone for joining. I don't know. I think personally, the first thing to say is that I really acknowledge that there's people in a lot of really, really difficult situations. So I feel that I haven't been impacted that badly. And I think the main thing that has happened for me is like things related to my mental health. So being in lockdown for what now seems too long, and at the beginning didn't seem like that long, is now sort of having a toll, I guess, and I'm learning to look after my well-being in that process. But that's mainly, it's just like being on my own in lockdown. It's just been a little bit long. But besides from that, I'm good, in good health and working, and yeah.
Well, thank you all for sharing that. And I think we kind of asked that because we wanted to just acknowledge that all of us, those of us that are doing the work and those who aren't, who are not working, are all kind of impacted and managing this in lots and lots of different ways. So thank you for sharing that. So without further ado, I'm going to hand over to Michael, who is going to talk through accessing clinical services. So Michael, over to you.
We're going to do the poll first.
Sorry, my bad. Sorry, apologies. Over to Jim, who's going to do a poll, and then to Michael. Live TV, what can I tell you?
Okay, so our first poll, we thought it'd be quite fun just to do a couple of polls, so that all of you can be as involved as possible during the session. So we've got a couple of them. The first one is this one, which is: has the COVID-19 lockdown impacted on your ability to access clinical services? So if you could just vote yes or no on that. Okay, so we've got, has the COVID-19 lockdown impacted on your ability to access clinical services? 67% yes and 33% no. So take it away, Michael.
Fine. Now, let me just try and share my screen because I have a little presentation. Okay, thank you. So I am going to just run through in the next 7 or 8 minutes some issues around COVID and HIV and access to services, clinical services, and a little bit about sexual health. And I will make sure that I stop. I'll keep an eye on my phone with enough time for questions. I've picked out a few key areas, but obviously if anyone's got questions about anything else, then put them in the chat, or we'll have an opportunity to share those after I've finished. So as I said, I'm going to talk about people living with HIV and COVID, access to services, and then we'll have some time for questions. Sorry, it's a bit busy, this slide, but the key message is around HIV and COVID. Top line is that there is and there remains no evidence that people living with HIV are any more likely to catch COVID compared to people who are HIV negative. Where there's been some, I guess it's maybe more grey, is about the question that if you do catch COVID with when you're living with HIV, are you likely to get more ill? And obviously, an infection or a viral infection like COVID-19 does affect people who have a weakened immune system. So there was a lot of discussion, in the early days of the pandemic about what does that mean for people living with HIV? What does a weakened immune system mean? Who would we say who is living with HIV actually has a weakened immune system? And the other challenge you meant to remember about this is, this is a completely new virus. So we just don't have a huge amount of information or data. We don't have research studies on people living with HIV who've had COVID. So this advice has to be based on kind of expert opinion rather than research or academic data. So essentially, the definition of somebody who has a weakened immune system in the context of HIV, and this is the guidance in the UK, and if you're calling from outside or joining us from outside of the UK, you might have different guidance locally, but our definition of somebody with a weakened immune system is somebody who has a CD4 count of less than 200 and or has an undetectable viral load. In other words, isn't on effective treatment that's fully suppressing the virus. So certainly in the UK, on that definition, the vast majority of people living with HIV would not be considered to have a weakened immune system. In other words, the vast majority have undetectable viral loads and have CD4 counts which are greater than 200. One of the reasons that they got concern and confusion, and Mark's alluded to this, the texts that were sent in error to some people living with HIV, is that the NHS England and Public Health England have identified about 1.5 million people who they're defining as extremely vulnerable. And these people are advised to shield or to self-isolate for 12 weeks. That means stay at home, don't go out, don't have any contact with anybody outside of the household. And the people in that group are people who have some cancers, or particularly cancers of the blood, like leukemias, people who are currently having cancer treatment, like chemotherapy, which would weaken the immune system, people who've recently had an organ transplant and are on drugs to suppress their immune system, people with severe lung disease, like cystic fibrosis, and people who are having renal dialysis. Now, those people who fell into those categories got a letter from their GP telling them to shield. And as Mark said, some people living with HIV got letters or texts telling them that they should shield. That was a complete error. No one living with HIV is on that list, and nobody should have received that text. Having said that, our expert guidance, so this is guidance that the British HIV Association and the Terrence Higgins Trust has pulled together, does recognise that there is a small group of people living with HIV who have very advanced disease and would probably be at similar risk of COVID disease as those people who are on that shielding list. And we define that as somebody who has a very low CD4 count, so if CD4 count less than 50, or who has had an HIV-related or AIDS-defining illness in the last 6 months. So although they aren't on the NHS shielding list, we are recommending that people in that group do follow the shielding guidance and completely self-isolate because their immune systems are particularly weak. So just in summary, for the vast majority of people living with HIV who have an undetectable viral load and a CD4 count over 200, the advice is exactly the same as for everybody else. And that currently, although it's going to maybe start changing after this weekend, it's currently stay at home, only go out for a few reasons, and if you do go out, distance yourself from other people by at least 2 meters. For people who have a CD4 count that's between 50 and 200, the advice is the same. Follow the same stay-at-home guidance, but it's just even more important that you follow it to the letter. And as I said, for people who've got very advanced disease, CD4 count less than 50, or a recent age-defining illness, that's what ADI stands for, should follow the guidance for shielding and self-isolating. Practical things, because this is something else that people are often concerned about. There are no concerns about supply of medication. You know, there is plenty of HIV medications. You really shouldn't stockpile medication because that is what puts a pressure on the system, and that does make an impact on the supply. You should always make sure that you've got at least 1 month's worth of medication, and if you've got any concerns about running low, to get in touch with your clinic. And clinics are all doing slightly different things around the country, but very quickly put things in place to make sure that people's deliveries of medications were continuing, or there are ways for them to get hold of the medication. A lot of routine blood tests and monitoring have stopped as we've had to reduce face-to-face services, or certainly been reduced in frequency. And that's fine, really. And actually, for a lot of people who are stable, who have an undetectable viral load, maybe no other medical conditions, it won't matter if you miss one of your regular set of blood tests. And in fact, if your clinic says to you that it's fine not to have your blood test done, that's a sign that you're well. It's a sign that there's nothing to worry about. And clinics have kept a small amount of service going. So people who do need to have blood tests or come in and see us are still being seen. Anyone living with HIV on this call will know, and it's come up on that poll, HIV clinics have had to significantly reduce the services that they offer. There's a number of reasons for this. It's partly about reducing infection risks, so we're not getting people in face-to-face and we're able to follow the guidance to stay at home. It's partly because we've had a lot of staff off sick. 30–40% of our staff were off sick at one point. And it's also, as I said, as has happened to me, many of us, well, nearly all of us, at the peak, got redeployed to go and work in the hospital, so we didn't have any staff in the clinics. Generally, people are being asked not to walk in. Different clinics are doing different things. Pretty much all non-essential appointments have been cancelled. But as I said, there is still some activity going on. So if you're worried, if you're concerned, if you need something, get in touch with the clinic, because we are still seeing people, particularly those who need to see us, like those who have been recently diagnosed, recently started on treatment, who are not undetectable, who've got other chronic medical problems or complexities like unstable or poor mental health. So the bottom line is, even if it's difficult to get in touch with the clinic, get in touch with us if you need or want to ask a question or are worried. As I said, different clinics are managing it in different ways. The best advice probably is to go to your clinic's website first, because that's the easiest way for us to give information. So they should be updated to tell you what's going on and how to contact the clinic. But if you need to, just call the clinic as you would do normally. But I'd say just be a bit patient, because, as I said, we don't have very much staff. So certainly in my clinic, it's taking ages or longer than usual to answer the phone. As I said, for the majority of people, delaying routine blood tests won't be a problem at all. And obviously, if you have symptoms suggestive of COVID-19, the main ones being a new persistent cough and a fever, then stay at home. Don't come into the clinic. The other point I just wanted to make is that this is going to be with us for a long time. Even when the lockdown starts to get partially lifted and we start to deliver more face-to-face services, it's not going to look like it looked like it was before the pandemic. Even if we're able to see more people, it's likely that we're going to still have to maintain 2 meters of social distancing, which means we'll be able to see far fewer people in the clinic at any one time. So there is going to be ongoing impact of the pandemic on how your HIV care is delivered. And actually, there's a lot of things that have come out of this which are better and will keep. So things like postal delivery of medications, telephone or video consultations, fewer blood tests if you don't need them. So some of the things we've put in place to deal with the pandemic, we will keep going over the next few weeks and months. I just wanted to briefly mention a few places where you can get support and advice, and I know that we're going to be sharing links and resources during and after this. At Terrence Higgins Trust, we have THT Direct, and you can call for advice. The telephone number's there, and we've got some blogs specifically related to COVID-19 on our website. I'm not going to say much about THT at home, because I know Jim's going to talk about a little bit about that later. I would also recommend the Prepster COVID resources. They're brilliant, and there's a really wide range of topics. So have a look at that on their website. And I'd also just mention that there are many other charitable organisations that are providing help and support for people living with HIV, or for LGBT individuals, or for other members of our community. There's a link there to a page on Stonewall that's got a list of loads of organisations. And I've also, I'm not sure if he's going to be able to send it out, but I've also sent Mark a list of other LGBT inclusive organisations that provide support on a range of things: mental health, isolation, suicide, substance misuse, domestic abuse, lots of things. So there's plenty of help out there, is the message from that. Going to quickly whiz through that, but just to say the last thing about sexual health services, integral to keeping good general health, good HIV health is good sexual health. I will quickly go back to that because I quite like it. We at Terrence Higgins Trust have been running a No Hookups campaign, which is really about talking openly about how we manage our sex lives when we're meant to be locked down and hopefully not hooking up. But just to say, in the same as any other NHS service, sexual health services are massively, massively reduced. There is a little bit of skeleton available, but very little for sort of urgent or emergency cases. Pretty much there are no walk-in services at the moment, and where they can, services are providing online STI testing and contraception. And it's important that we keep some sexual health services going, because even though we're saying no hookups and no, during the lockdown, we need to recognize that that's not a reality for everybody. And actually, people may be in a household with, for example, somebody who's got a detectable viral load, or they're using condoms for their contraception and they need some ongoing sexual health care as well. So that's just a little bit about sexual health service as well. I will stop there. let me unshare.
And
I'm just trying to unshare this. Sorry, I'm going to do that.
there you go. You're back.
Thanks.
Thank you so much, Michael. That was brilliant. Thank you. Really concise. Got lots of stuff there. Before we go over to Dominic and with questions, just to let everybody know that the list that Michael has mentioned, we will distribute it at the end, and we'll put the email address. You will need to email us directly for us to send you that list. We've got a couple of lists which we've compiled, which we'll get out to you. We'll give you the email address at the end of this. Dom, any comments?
Yeah, so we've got a couple of questions actually for Michael. So somebody's asked, I have an undetectable viral load and also have epilepsy. My GP and HIV clinic advised me to shield for the 12 weeks. Was this really good advice?
Now, I don't like to contradict other medical professionals' advice. From the point of view of your HIV, undetectable viral load, that in itself is not a reason to shield. And to be honest with you, I don't know why you would need to shield solely for your epilepsy. Epilepsy is not a condition that should necessarily affect your immune system. There may be other things about you, your medication or your medical history that I don't know about, but it might be worth a recheck. I mean, I think, you know, even for medical professionals, there was a lot of confusion in the early weeks about what we should do, what we shouldn't do. And often the safest thing to do is just to say shield. So it's worth getting back in touch with your GP and just reviewing that now that the dust has settled a little bit and we're clearer about who should or shouldn't shield.
Thank you.
And one further comment is, what would the future look like for routine blood tests if the virus is likely to be around for a while? Would nurses be wearing more PPE as standard?
Yeah, I mean, I think there's two things about the future of blood tests. One is that I think we're going to do a lot less blood tests. I think we overly do blood tests. So one of the things that we've been forced to do when we've been forced to stop doing blood tests is actually to reassess, well, actually, do you need that every 6 months? Can we do that once a year? Do we need all of those things? So one of the things I think is that we'll have a review of the range and the frequency of the testing that we do. For the time being, nurses will be wearing PPE. I mean, it's not the whole kind of full ITU body bag. No, that's not the right word. Sorry, the ET type full body enclosed stuff. It's a mask, it's a visor, it's gloves and an apron. We're wearing those at the moment, and we'll probably continue to wear those as long as Public Health England advises us to, and that's based on the background levels of the virus in the community. It's based on where we are in the pandemic, and obviously it's based on whether or not we got a vaccine. So for now, we will continue with the PPE. And it may be that you're asked to wear masks as well. I think that's the other thing. We'll have to see what the guidance is, but I think one of the ways to get the clinics open sooner is that people coming into clinic may be asked to wear masks as well, but we'll see. That's not a thing yet, but that may be another thing.
All right, thank you so much. Thank you very much, and thanks for your questions or comments as well. Before we go over to Gary, Jim, you've got another poll for us.
Yes, I do have another poll. So, has the COVID-19 lockdown impacted on your ability to access support from your community? Wow. Okay, so about the same as the previous one, actually a little bit, few more people saying, 73% people saying it has affected their impact to access support. Gary, tell us about what support is available at the moment.
Thanks, Jim, and thanks for everybody that's joined. Let me take the poll off. So although I've been on furlough, I've been linking in and had a Zoom conference on Monday with services from across England and Ireland, not from Wales and Scotland, I am afraid. So I don't have an update in relation to that. And I'm also a member of the UK CAB, the Community Advisory Board, which is the National Treatment Advocates Network. And I keep up to date with what's going on there. But I've so far spoken to service providers, so HIV voluntary sector services from Brighton, Bristol, the Southwest, London, Midlands, Manchester, Leeds, Hull, Newcastle, and Northern Ireland. And I think the main thing to really say is that although it's not business as usual, all of those organizations are still providing the same support services that they had previously, but in a different format. So they're either doing telephone or online support via Zoom, Skype, WhatsApp, whatever the personal preference is of the person wanting to engage, they will work with that. And that's been done with staff and peer support volunteers and mentors as well. It was mentioned earlier that this anxiety and concern around the potential that people, particularly who are most vulnerable, might not have access to the technology or ways of engaging. And so some of the creative ways that people have been dealing with this on a national level and through those regional organizations have been to think about what they could do to support people. Most were very keen to say that actually this hadn't proven to be true, and most of the people that they were in touch with were still in touch with, and that they were in fact seeing more people that they hadn't seen before who actually were finding it easier to get in touch online because of the distance that they had from the charities before. So there are quite a lot of services who, although there's been the face-to-face services are closed, have seen an upturn in the online check-ins because of the fact that there's been wider availability to access from home. And so what they've been doing, different approaches in different places. Some have had peer mentors providing Zoom tutorials and online tutorials to people that weren't really up to speed on how to use technology. Where there was limited availability in relation to broadband access, some charities have fundraised and been providing dongles, top-ups, or paying for Wi-Fi at home for people, particularly those who are vulnerable and shielding and therefore more isolated. And so Peer Action in Brighton, for example, started a local campaign to get donations of old tablets or laptops that they then basically wipe and clean up, put Zoom and other apps on, and then get them back out to people locally who are shielded and isolated at home so that they can engage and link in as well. So it's something to think about in terms of what might be available to you locally, what you might be able to do to help, and just to think about, you know, what's going on locally for each of you. So the changes have really resulted in a lot of the agencies saying that actually we're seeing more people from a wider range, and we will continue to work in this way moving forwards. I think that the fact that, you know, previously most organizations had face-to-face support, either one-to-one or in groups, the ability to deliver more support to more people via the online methods means that actually this is something that's going to be maintained moving forwards. So if you have a monthly gay men's group or a monthly women's group, the ability to do something on a weekly or in some cases daily basis has been a fantastic resource and meant that actually the calls and the contacts that had been made around isolation and mental health issues, which has been the main issue that people have been calling up with, have been really able to be dealt with quite quickly and link people in quite effectively. As well as that, obviously, the opportunity to deliver innovative ways of engaging. So there's been lots around, as well as the social groups and activities, there's been mindfulness, relaxation, yoga, exercise classes taking place. And that's been quite a bit of a shift for a lot of the organizations, but most have volunteers or staff members that can do different well-being kind of programs, and that can be done virtually to people in their homes. And so that's worked really, really well. So access to services has increased in this time. Casework has been continuing. The other thing that we've been seeing a lot of in terms of the people that I've spoken to has been calls around poverty, benefits, food issues. Charities like Food Chain, for example, which are based in London, have been doing food packages for people as far afield as Leeds because of the issues that some places, HIV services have access to their own food banks, or at least did before lockdown. Some had close referral pathways with partner organizations locally, but there are also others that didn't. And so depending on where you are, there may be different availability of support on that level. but everybody is really working to look at how we manage those connections across the voluntary sector and make sure that nobody is disadvantaged because they can't leave their homes. And so there's been a lot of work done around supporting people to get their needs met. Some of that has also then linked back into mentoring and the volunteers that we have. For Positive UK, I worked on the national mentoring program, and a lot of those mentors have been providing online support in the same way that they were able to do face-to-face before the crisis. And that's done by Zoom, Skype, telephone, whichever people prefer. And clearly people are getting a great deal from that. But what we're also seeing now is the mentors being used as buddies as well, because of the fact of isolation and people who are in a shielding situation and are seeing nobody, that can be really challenging. And so just a daily or a weekly check-in for somebody to have a chat, to be able to use a video conference and see somebody for a conversation means a lot to people. And so that's been a big difference. The other thing that's been mentioned in relation to the mentoring process and supporting people who have been in touch with the agencies because of issues around their HIV is that actually talking online has meant that people are going into more depth and more detail and dealing with things on a deeper level than they previously were face to face, which perhaps is not surprising when you think of people going to meet up for a coffee somewhere in a chat. Maybe you don't really want to have those conversations in a Starbucks. Or even in a park somewhere. And in fact, certainly when THT launched My HIV a decade ago, the online counsellors noted at that point that the ability for people to really get into the nitty gritty of things much more quickly online was something that they saw there, and it's clearly something that's still being seen now. So the other thing that we've seen is people who used to volunteer but have kind of drifted off, getting back in touch with organizations to say, look, we're kind of either not doing anything at the moment, or we're at home working from home but have other time available. Is there anything we can do? And so if that's something you're interested in, you could find out what's available locally for your own services, the people that you've accessed support for or know who know are around but maybe haven't accessed support from. You can get in touch with them to see what's available to you, but also to see what you might have to offer if there's anything that you'd like to do. And I'm sure organizations would appreciate that call and looking at how they might be able to include you in the help that they offer. I'm not going to go into the specifics of what each of the services offer, but the British HIV Association and National AIDS Trust created a resource which is on the Beaver website within the COVID links. And I've got Dominic to be able to add this here. And so you can look on there and there's a list of what the organizations are, what their numbers are, what the link-in is for the services they provide, and also in a large number of the cases, what services are on offer on a day-to-day basis. If there's a service that you're looking for that's not on that list, then I've also provided the link to the NAM Services Finder, which covers all of the HIV UK services, so you can look at that. Really, the organizations that wanted me to really be clear that they're there, they're available for support, and if there's anything that is needed, either from you or from somebody that you know, please get in touch. They are seeing lots of people in touch. They're seeing almost no referrals from clinics, probably because of the fact that the services have been changed so dramatically. And that actually, with the best will in the world, when you do have a telephone conversation with your doctor, half of the things you think about don't really come up in the same way. So it's going to take an adjustment, I think, to manage that. But what I'd also say is that many of the clinics I spoke to in that conversation, because we train peer mentors to work in lots of clinics, where there were local services but not voluntary sector services, was that the clinics are thinking about how they will move forwards with this. And certainly in Leicester, there was a pathway that was for newly diagnosed patients going straight into the local service from the clinic. And certainly some of the London clinics I was talking to were thinking about if we're going to be doing online consultations, the potential to be able to link people in with peer support via a resource like this might be a really useful way of starting to make those connections where people maybe wouldn't think of going to their local voluntary sector service. I think Mike's point about, the changing face of HIV services, I think this is going to change, not just during the COVID crisis, but moving forwards, that it's a time of such significant impact. It's one of those periods where we look again at what we do and how we do it. So I know I had my last blood test done before lockdown, and my appointment was done during lockdown. And so I had a phone appointment with my consultant. And then I went into the local pharmacy to pick up my medication, and it worked really, really well. And for me personally, I'd be happy to do that once a year and not really go into the clinic. So it'll be one of those things. And I would suggest with that, it'll be like anything else has been over the years as clinical services have changed, is that it'll be done through choice. And we'll have the ability to say what we need and how we want our needs met within whatever the restrictions there might be. So I think there's a lot that's changed both for the voluntary sector and the clinical services, but the message really is that the support is still there, and really to think about what you might want or need or might be able to offer if you have an interest in contributing something for yourself. So the HIV sector has been really used to working against the odds and coming up with innovative and creative solutions to challenges. And so, I think we'll probably do just the same with this. And so any ideas that you have, anything that you can contribute, please do. And if there are any questions, I'm happy to answer them. Was I within time? Oh, I can't hear you.
Oh,
there
you were bang on time. All those years of working with me. Right. But Dominic, were there any questions or comments?
We haven't got anything specifically through for Gary at the moment. There was an earlier comment that someone's put through, which is possibly picking up on what Michael was talking about. Where can I get a mask? Which probably is a bit of a difficult one to answer at this point in time, I would have thought.
Okay.
I noticed in there that you've put the forum up as well. That's the other thing in relation to being able to just check in and chat on a written basis. Then the My HIV forum is a great place to do that as well. So I can see the links that you've got there for the NAM service finder, the service directory through Beaver and NAT. And so, there's also the link there for NAT. NAT have had quite a few calls around people who were being asked why they weren't in, or were being told by a GP that they needed a shield, and then were communicating with their employers, and they hadn't disclosed their HIV status. And so around all of the thorny issues around who to tell about your status and what changes might need to be addressed, NAT have a piece up on their website that looks in quite a bit of detail around that, and they have phone support on it as well still, so that's available.
Thank you, Michael. Michael, did you want to come back with a comment about the masks?
Yeah, I've just seen that a lot of chemists have them, and actually a lot of corner shops have them.
Yeah.
And I know people who bought them on Amazon and eBay and stuff. The only thing, I mean, in England, well, in the UK at the moment, the kind of the scientists are a bit out about the usefulness of masks. It's not going to do you any harm, and I think certainly there's a good evidence that if you are coughing, it does protect other people. My only tip about it would be that you don't overuse them, because certainly those paper masks, because if you're breathing into them, they get a bit damp. That actually makes it easier for virus to get in. They are really only meant to be just used once. You can use them for a bit longer, but just if they start to get wet and frayed, then they're definitely not worth it.
Okay, great, thank you. Before I move on to Jose, Gary, I've just got a couple of questions for you on the back of what you've just spoken about. So thank you for highlighting issues around digital poverty, and that's really good to see that somebody is doing that. And we'll make sure we'll kind of post the information around that. My question was something around, because we're seeing a lot of push online around testing, and there has been a bit of a conversation around this is a great opportunity to break the HIV, the STI chain. There's also been some contradictions around that as well, which I've seen. So my question is this, is if somebody today goes and gets a HIV test and they're diagnosed positive, what support can they get?
It's a very good question, and I can provide a London perspective on that, at least, because there's a discussion at the moment through the Fast Track Cities initiative around what is being done for people who are street homeless, who are currently in hotels and hostels, who are being seen, and to look at having a full health check for people. So they're already looking at some things, and they're looking at doing a full bloodborne virus screen for Hep C, HIV, and really to look at that. And one of the things that we fed back from the voluntary sector and myself as a community representative of somebody living with HIV was that if you are going to offer people those tests, then you also need to make sure that as part of the pathway, not only do they have the post-test support if they're diagnosed positive, but they need to have that linked in through the voluntary sector. And so that needs to be part of the pathway moving forwards, so that the access to somebody to be able to talk them through in an informal basis and a non-clinical perspective is just as important as in terms of providing holistic care and thinking about somebody's well-being as just giving them the medical facts. Okay. And so I know that that's been agreed in relation to what will be done for London for fast-track cities. Mm-hmm. As I said, I know of other places where there's been strong links that have been formed or strengthened as a result of the crisis. So as I say, a colleague in Leicester was talking about the fact that the clinic have diagnosed about 4 people during the period of lockdown, and they've all been referred directly into services for phone support, which wasn't happening before. They were never getting referrals from the clinics previously, and now they are. And so I think it's a mixed bunch, and what we're trying to do. Beaver were on the conversation that we had on Monday, and so it was a matter of really making sure that's fed back nationally to HIV clinicians, so that when people are thinking about this, when they're seeing new diagnoses and people in for their first appointments, that connection is made to the voluntary sector as well, so that they're not missed.
Okay, thank you. So resources that we will pull together, which we can circulate upon request, all of that information will be there. And I would recommend highly that if somebody is in that circumstance, the first port of call will be THC Direct, and they can then filter out to go to Positively UK and My HIV and a range of different services. So go there. All right, so conscious of time, and I'm going to hand over to Jose, who's going to talk about community services around London, but also for people whose first language isn't English. Over to you, Jose.
Thank you, Mark. So yeah, I'm just gonna do a brief overview about services in London. I think the first thing that I wanted to say, and that it's been quite interesting to see and to experience, is sort of the speed in which community services have adapted themselves to deliver the work that they were delivering before in different ways. So we're seeing a lot of that, and it's been different for every organization and at different speed and a different pace, but most of the community organizations, as Gary was saying, are still there and are still available to provide different support services. So I guess I thought about it in 2 main ways, and it's one, talking about specifically HIV organizations that support people living with HIV around different topics. And I might quickly just share this screen so that you can see that. So this is small. So yeah, basically these are some of the organizations that are already offering or since the very beginning of the lockdown offering some of their services in different ways. Those different ways being online or over the phone or via email, or even now running groups on Zoom or activities on WebEx or different sort of medium. So organizations like Positively UK, Positivist, Metro, SASH, NAST, Living Well, River House, Terrence Higgins Trust that Jim will talk a little bit more about, THT at Home. But all of these organizations, all of us have moved most of our peer support services or services that are tailored specifically to people living with HIV. We've moved them to these different ways. So we're providing a lot of counseling online, and we're providing a lot of peer support groups online as well. So that's already happening. So I guess the main advice will be to go to that organization that you know and that you're used to and that you've been working with, because if you haven't received any sort of communication from them, they're still there. You might have received some communication, so do get in touch and do access some of those services that are available in the meantime. Throughout this process, I guess for us as community organizations, it's been a process of sort of adapting the way in which we work, but also trying to understand what are really sort of the needs of people. And we definitely see an increase in things around like financial hardships and yeah, and things around domestic violence. So we're seeing a change in some of the needs of people living with HIV under these circumstances, things that were already there, things that we were already seeing, but that we're seeing much more. And then I guess at the very beginning, it was a lot of the support, a lot of the peer support that we were providing was around clarifying some of the issues that Michael and Gary already talked about, like the shielding confusion and all of the guidelines confusion. So we were sort of working with the people that we usually work in explaining these things and making sure that everyone had sort of a route to get access to their treatment, through delivery services and all these things. And now we're just looking into more sort of detailed things around, okay, what is it that we want to do in groups? What is it that people are struggling with? Is it physical health? Is it mental health? Is it both? And providing services that address these needs. So that's in terms of the HIV services. We've definitely a lot of organizations that have what we call hardship grants are still there. We're seeing a huge increase in the demand for those hardship grants, to a point that a lot of other HIV and community organizations have had to create their own hardship grants from scratch, just to deal with this current situation. So yeah, that's all happening, and that's also part. This is all from the update done by BIVA and NAT. So this is being updated constantly. So if the organization that you usually attend or that you used to work with isn't here, it might be because it has just taken them longer to adapt to this changing process, but they might be in the process of doing so. So make sure you have a look at that link. And yeah, so definitely there's that variety of services that were before in person. We're still having them online. But there's also these other organizations that I wanted to talk about that are other sort of what I think are tailored and key services at the minute. And is, yeah, basically organizations that are not specifically around HIV, but that meet a lot of the needs of us people living with HIV. So as Gary was mentioning, like the work that the food chain has done, it's impressive. So they stopped doing their in-person lunch, but they're delivering food to way more people than they used to. What food banks are doing is the same. They sort of swift very quickly from seeing people in person to delivering food vouchers online and working closely with the HIV and community organizations to deliver those to the people who were more in need. I guess there's also here a few very key services for trans people, for example. So if you are a trans person living with HIV and your preferred support is from a trans person, then it might be ideal to work closely with Clinic Q, and they're also moving some of their services online and over the phone. They have already, so they're there for you. So don't feel that you need to go anywhere else because the organization is there. If you are a sex worker living with HIV, the needs might be different as well, but there are a few organizations and collectives that have come together to support sex workers in this, that it's a really difficult time because most of their work have stopped. So have a look at the Swarm Collective and what National Ugly Marks are doing. If there's things around, or if you or anyone you know are experiencing situations of abuse or domestic violence, then it's really key that the work that organizations like Gallup are doing. If you have a religious background or that's the kind of support that you prefer, there's also organizations that have tailored support around well, HIV or being LGBT and having a faith background. So there's things like the Catholics for AIDS Prevention and Support, and there's House of Rainbow as well. If you are a Spanish or Portuguese speaker and are having issues around either your immigration or accessing welfare benefits or unemployment, so with any of these, all the organizations that are part of the Coalition of Latin American Organizations, they're all providing support online. So IRMO, LDPP, LAWA, the Latin American Women's Rights Service, they're all there. They all have their services. They're all advertising their services online. So it might be really important to get in touch with them, because the specific things that they do are very different to what HIV organizations do, but definitely it's something that might be worth looking at. yeah, and I guess, and the same with organizations like Turning Point and London Friend, who are providing support for people who have drug or substance use or misuse and are looking for support in this moment and might find it really difficult to cope with a situation like the one that we're in. They're also providing support online. They're also doing meetings on Zoom. So do get in touch and look at these organizations, because they all might be able to support you with what you need at the minute. Yeah, and I guess the last thing I wanted to say is, like, we are, as we did at the very beginning, looking into how are we gonna adapt to this new way. We're now doing the same thing, but on how are we gonna go back and what our service is gonna look like in the near future. And of course, we're doing this following the government advice, but we're also doing this while understanding the people that we work with and our members and the things that we need to consider accordingly, and things like protective equipment, and if we as community organizations are going to have access to this when it comes to it. And we really don't have the answers to a lot of those questions yet, but I guess we will, as we very rapidly shift to the online, we will very rapidly shift to a mix of, for me, I guess, I think it will be an ideal way of having a mix of the online, but also a in-person support, because definitely there is for a lot of people, it's easier to access online services. A lot of people who couldn't come to our organizations because of mobility issues are finding really easy to join us online, and that's great. But for a lot of people, it's not the same to have this sort of medium in between, and they're really looking for meeting again. So hopefully we will be able to have a mix of both, and we're working to see how this will look and how this will happen in the next couple of months, I guess. And yeah, that's pretty much it. I'm happy to take any questions now. I don't know if I went too quick, if you can hear me.
Thank you so much, Jose. Dominic, do we have any comments or questions come through?
Yeah, so we've got a comment about getting in touch with G-Day, who is, sorry, I just lost track of this, who is at House of Rainbow, who says you can get in touch with him directly. And he's posted his email address in there, anything relating to matters of faith, religion, and sexuality. And
great, Joy, thanks.
Yeah, and he says we've just launched our accountability partner support to help increase adherence. So that is in the chat function. And then someone's just picked up a comment here saying, I agree, it's best to have a mix of online and offline support, i.e. face-to-face.
Yeah. Thank you so much. Thank you all for your presentation. I'm going to pop back to Michael real quickly, who, Michael, we last met on the 20th of March, the day before the weekend the lockdown was announced, and we had a COVID and THG Prepster COVID update. What's changed in those, six weeks now, nearly 2 months?
So I think probably most people will know that the big changes, because it's really hard to miss all the data and the graphs and the information that comes out every day. Well, since then, obviously, we've been locked down and we've continued to be locked down. We have seen a huge peak in cases of COVID, in hospital admissions, in intensive care, and in deaths, unfortunately. But we are thankfully definitely on the other side in terms of the numbers of all of those things. If you can bear to watch the news or see the daily briefings that are coming out of Downing Street, the reduction in cases, particularly in London, has been really quite remarkable. But we can't underestimate how much this virus has really hit our country, and more so than many other countries. So that's, I guess, has been the main thing. We're learning more about the virus all the time. There's still a lot more that we need to do. We're a long way away from a treatment. We're a long way away from a vaccine. We're beginning to get a little bit more information about how the virus affects the human body. We're beginning to understand a little bit more about how it interacts with other conditions and comorbidities. We're getting some early data coming out from some clinical trials around potential treatments, not vaccines. That's still some way away. And it's probably also just worth briefly mentioning, because I know It's touched on this question about whether or not HIV treatment will work against the coronavirus. At the moment, there is absolutely no evidence that any HIV drugs work against COVID. So that's, I think, an important thing to note. In fact, there was one study using a drug called Kaletra, which we don't really use that much anyway, in China, in about 200 people who had quite severe COVID, and it showed it made absolutely no difference. So there are trials going on at the moment, but there is nothing that's looking very exciting around HIV drugs. Some other drugs maybe, and you might have heard about a drug called remdesivir, which is a drug was developed to treat Ebola. So that's looking maybe that might be something. So there's a lot of clinical trials going on at the moment looking for treatments, which will be really important. There's just another couple of things which are kind of more lockdown related than coronavirus. I was just going to say when we finished, we've touched on this already. Many of you may have seen this campaign that was started by Dean Street about breaking the chain of infections, and I think that is a really massively exciting opportunity. If you haven't heard about it, essentially the principle is we've all been locked down for 6 or 7 weeks. Mostly people have not been having sex, so the number of sexual encounters that have been happening has gone down dramatically. So number of HIV transmissions will have gone down dramatically. There'll be hardly anybody who's recently acquired HIV, and they're the people who are the most infectious, and pretty much everybody's outside of the window period of the test. So we have a real opportunity to test for HIV and STIs. The same principles apply for STIs. Before the lockdown's over. So we're really encouraging people, and spread the word in all of your network, your friends and your social, that if people don't know their HIV status, now is absolutely the perfect time to get a test if you can access one. And then the final thing is just the service stuff, and we touched on that before, and you will, everyone living with HIV will know how much the services have been impacted on, and this is not going to go away. It's going to be like this for a very long time. So we're going to slowly expand what we can do, but and I don't think it's necessarily a bad thing, but how we deliver HIV care is going to be really different in the next few weeks and months.
I mean, thank you for that update, and things have significantly changed. There is one thing which I want to pick out just really quickly, and I'm taking kind of like host prerogative on this, is that we have also seen the huge disproportionate impact on people from Black, Asian, minority ethnic communities as well. And again, we see and people from poorer, deprived communities, and we know that many people with HIV occupy those spaces or come from those communities. Is there anything in addition that we should be thinking about addressing, or is there anything there? Because it's increasingly on the news. Yeah,
definitely. There's definitely something there. I mean, pandemics like this heighten and worsen existing health inequalities. They not only shine a light on them, but they make them worse. I think at the moment it's something that we just need to really put pressure on policymakers and sort of research scientists to really understand it. There is definitely the Black, Asian, minority ethnic thing is definitely a thing in healthcare workers and in patients. They are disproportionately affected by COVID, and it seems also that they're disproportionately affected by death from COVID. We don't really understand exactly why that is, and it's probably a mixture of medical, social, maybe genetic things, but it's something that we need to be aware of. It's something that we need to be sharing that information in our communities, and it's something that those of us that work for organisations or with policymakers to really push on getting that work done. The other thing that I think is really important, and you touched on this, is I think whilst the focus on the BAME thing is really important, we need to make sure that that's not at the expense of all the other minority communities, disadvantaged communities. I have a slight concern that everybody will get overly excited about the Black, Asian, minority ethnic thing, and that's right and important, but at the expense of LGBT communities, sex workers, migrant populations, homelessness, and the intersectionality between those. By asking the question about BAME, what about gay BAME? What about old BAME? What about disabled BAME? So I think there's a lot more that we all need to do to kind of like keep those issues alive.
Thank you so much for that, Michael. Right, so we're going to wrap up. We are on time. We've got a few more minutes. Jim, back to you.
Yeah, thank you, Mark. Actually, I just had a quick question for Michael about this breaking the chain, because You know, we've sort of been told that, you know, we shouldn't really be going and getting STI tests unless we're, you know, symptomatic. Is there a suggestion here that we should be trying to get, you know, are we being encouraged to go and get STI tests whether we're symptomatic or asymptomatic before the end of lockdown?
I think what we're pushing is postal and online tests. So yes, essentially, I mean, if you're symptomatic, then clinics will see you. You know, so if somebody's, I mean, it's not, you know, somebody could have symptoms of an STI that they caught before the lockdown. So I think having symptoms doesn't necessarily mean that you've been breaking the lockdown. But if you've got symptoms of an STI, then you should get in touch with your local clinic. What we're really talking about with the sort of like the test now breaking the chain thing is asymptomatic testing. So it really only works if you live in an area that has access to online or postal testing, because certainly the clinics won't do face-to-face asymptomatic testing. So it's a good point, Jim. Thanks. So it's about getting, it's really if you can get an online or postal test, and certainly there's a lot going on. THT is doing a lot of work with Public Health England to see if we can increase the availability, because as always, London's quite well served. We've got a really good online testing service, but it's patchy across the rest of the country. So we're seeing if we can get some solutions to getting equity of access to online testing across the whole of the country.
Cool. Right. Okay. Thank you, Michael. So get your postal test kits if you can.
I just thought of mine.
Online. Great. Okay. So just to wrap up from my side, just to tell you a little bit about THT at home. I appreciate, you know, comment earlier about, you know, important to provide a mix of online and offline services. Obviously, we can't provide any offline or face-to-face services at the moment. But I mean, I think I'd say that, you know, as soon as we're able to, you know, we will be very, you know, very keen to bring back our face-to-face services, you know, in a socially distanced way. But in the meantime, we have a range of services which which at Terrence Higgins Trust we've sort of badged up as THT at home. And if you go onto the website, you'll see that they are pretty much all in one place now. So we've got our THT Direct helpline, which provides advice and guidance to anyone concerned about their HIV or sexual health, and that's open from Monday to Friday from 10 till 6. And I think that's also going to be soon extending into the weekend. We have free online counselling and emotional support for people living with HIV. And pleased to say we don't have any waiting list on that at the moment. We've got capacity in that service. So if you are looking for some counselling or emotional support, again, go on the website, register there, and we can get that up and running for you quite quickly. We've also got our online peer support platform, My HIV, which is moderated some evenings of the week, and there's lots of information on there and posts from people, particularly around coronavirus. We've got lots of really good stuff on My HIV around coronavirus, so have a look at that. And we've also got a range of online peer support, including events like this, but we've got a really good series called Living Well in Lockdown at the moment. So if you've got any kind of concerns around your well-being in lockdown, particularly around kind of anxiety, we've got some weekly sessions which you can sign up to, which it's a really good place where you can kind of chat in smaller groups with people, get some support. They're quite structured, and they're good sessions. And we've also got drop-ins for people who are over 50 and long-term diagnosed as well. And finally, we also do have our own hardship fund at THT, and also that, interestingly, you know, picked up a bit earlier about the issue around digital poverty, and we've also extended the criteria around the hardship fund so that people who maybe are you know, struggling to access support digitally, you know, we can support in terms of, you know, SIM cards and stuff like that. So if you or someone you know is in particular hardship and could benefit from that, then do point them towards that. So those are our services at THT at the moment. Back to you, Mark.
Thank you. And I would also suggest, Michael mentioned it earlier, check out the Prepster Covid-19 Hub, which has got loads of different pieces of information for a whole range of communities that we all work with and we serve, and a number of different issues. So, going to wrap up now. It's just gone after 4 o'clock. I'd like to first of all thank our speakers today, Gary, Michael and Jose, for giving your time and your energy and all of that fantastic information, which is really, really important and relevant. Thank you so much for that. The slides and the resources will be available if you want those. Dominic has put the link in the chat, but it's Zoom events at tht.org.uk, and then we'll get those lists out to you and slides as well. I want to thank Dominic for moderating over these past 3 sessions. We couldn't have done it without you. So this is the last of 3. The lockdown is probably going to continue. Some restrictions might be lifted. We only plan to do 3 because we were conscious that it might get zoomed out, which I think we are a little bit. If you would like more, drop us a line on our social media or THT and at Prepster. Just send us some more topics you'd like us to consider, and we might come back in June and do some more of these for you. Thank you all for taking time to be with us. Please take care, stay safe, and government guidance is saying you might be able to go on a picnic on Monday. I don't think so. Look after yourselves and look after each other. And again, cascade disinformation and learning down.